Hello everyone. Today we'll discuss a common clinical condition, very common, especially in old people, bedridden patients, spine injuries, spinal disease, and so on. So, what is this clinical condition? Is look at this. Look at this, like this. It is the sacral region, but you can see that sacral region. There is a deep lesion, ulcer as such. So, what is this clinical condition is? It is bed sore. All of you know that bed sore is a trophic ulcer. Trophic ulcer is a deep punched out ulcer where bone is formed as a base, and it is a chronic ulcer, especially occurs in the pressure areas, that is in the sacrum, heads of the metatarsals, then buttocks, ischial tuberosity, and shoulder, occiput, and so on. Common in the old age, common in the bedridden patient, common in the neurological patient, common in the spinal injury patient, common in paraplegic patient, and so on. So, that is bed sore, very common entity. There are so many stagings, classifications, different methods, different features, all those things I will not discuss, but you can go through my book. But what are the basic features? Remember, the type of trophic ulcer is a type of trophic ulcer. It's a deep punched out with the bone as a base. Bone as a base. See that? Bone is the base. It is common in bedridden patient, diabetic patient, spinal injuries, spinal disease, peripheral neuropathy. Already told, common in the sacrum. This is the sacrum. This is the sacrum area. Buttocks, shoulder, ischial tuberosity. So, how it is managed? Discharge study, image of the part, blood parameter. Discharge mainly to see the infection. Very common. Bedridden patient infection is common because of the continuous friction. Maceration occurs, so then sweat comes there. So, bacteria enters, bacteria multiplies, infection is very common. Foul smelling discharge, because many times they can't pass urine, control over the urination and the stool. So, there will be soaking, urine soakage, and contamination with the feces, all those things. So, that also adds on the problem for the persistence of the bed sore and poor healing of the bed sore as such. So, how it is treated? So, X-ray to take, you know what is the basic cause for that, maybe spinal injury, shear neck disease, old age, and so on. So, water bed, air bed, change of position, nursing care, that's the most crucial in the bed sore. Nursing care is the most important thing to make the bed sore heal. Of course, after that, through a plastic surgery, you can do a rotation flap or graft or vac therapy. It's very useful to allow it to heal and granulate to remove the discharge. And all those things are the other additional treatment strategies for bed sore. There is grading of the bed sore, which I am not going to discuss. So, this is the very common clinical entity which you will come across in the exam. They will ask in the CBME syllabus, and Viva they will ask, and they will put as a oxy spotter. And for a clinical discussion, you should be able to know what type of ulcer it is and how it is managed, what the difficulties, what are the causes. So, very important, very common entity. So, good nursing care is most crucial in this patient. Of course, eventually plastic surgery surgeons will come into the picture to do rotation flap and all those things. Of course, you may have to take an X-ray whether it is very close to the involved osteometry of sacrum is there or sacrum is very close or not. So, that is a different entity. Imaging is also equally important. So, that is about the bed sore basically. So, for detail how to examine these ulcers, go through my SRB clinical methods in surgery current edition with the video lectures. SRB is a manual of surgery current edition, detailed CBM syllabus with all chapters, of course, ulcer, including all chapters, X-ray, specimens, instruments, operative surgery, and quotations also there. You can always enjoy that. And my surgical operations about the local flap, other things, and tissue approximation book, small book, how to do technical skill, how to learn also it is there. And all my video lectures in detail as far as CBME syllabus is considered, with the clinical examination, instrument, specialties briefly, neurosurgery, cardiothoracic, urology also briefly as far syllabus is considered, also there in my DigiNow lectures through JP Publishers. You can also purchase that and go through that. All this will fulfill whatever requirement for your professional career as such, learning surgery as such, of course facing the exam. So, students, I hope you have understood basic thing about the bed sore as such. Thank you very much.